All right, everybody. So I really wanted to apologize there. It looks like the webinar link did not go out properly, so you weren't able to view this right away at noon. So I just restarted it now. So I'm just starting here at about 12:10. So again, I apologize, but we'll go ahead and start the webinar on tongue ties and tension. And then I will be sure to send out that replay link for anyone who registered so you can still view this information. But again, welcome to the webinar here. I'll do a little bit of an intro about myself. So my name is Dr. Jill Mork, and I am a pediatric and prenatal certified chiropractor at Family First Chiropractic of Verona. And so our focus is taking care of families, pregnant women, and kids. So we're really honored to see a lot of babies here at the office. And so my goal is to arm you with information so that you can make some informed decisions when it comes to your family's health. And so what we're going to be doing today here on this webinar is we're going to cover a lot of information, and some of that includes what these oral ties or tongue ties are, why they're important to get properly assessed and cared for, other providers in the area that are experts on this topic, and how specifically trained chiropractors play a vital role in the adapting, healing, and recovery process if a revision of these different ties are done. And so we're also going to cover some symptoms or signs to watch out for that could indicate oral ties, some common misconceptions regarding ties, and then we'll also go over how those ties create tension and how that affects the nervous system, and then also how that nervous system in turn affects the ties. So basically kind of a tug of war that's happening with the tension in these little one systems. And then also we'll share with you my personal experience regarding ties as well. And so when we talk about ties, first I'll kind of define what they are. So a tongue and a lip tie, first off, they also can be called tethered oral tissues, or TOTS for an abbreviation, TOTS. And so this happens when there is a tighter, thicker, or shorter than normal band of tissue. And that can be from that upper gum to the upper lip, which would be a lip tie, and or from the underside of the tongue to the floor of the mouth, which would be a tongue tie. And so these cause restriction of movement of the tongue or the lip. And then a really important thing to note also is that when there is a lip tie present, there is over 90% of the time also a tongue tie there as well. One other thing I'm going to mention is that there are things called buccal ties, which basically is a tie from the side of the cheek into the mouth there. We're not really going to be talking much about those, but those can be seen with a full oral motor assessment there too. And so with all of these ties that we're seeing, actually it's becoming increasingly more common in the little ones that we see here at the office. But I want to remind you that just because something is common doesn't mean that it's normal. So there might be a few reasons that you're watching this. It could be that, you know, maybe your baby has some signs of tension and you're exploring the idea of possible ties, or maybe you and your child, or maybe you know that your child has a tie, or maybe had a revision of ties, and you're looking to learn more information. But either way, I'm gonna go over a list of some of the common symptoms of ties in both mom and baby. And what is important too is that you or your baby could have one or multiple symptoms that I'm gonna mention. And so first, when it comes to mom's symptoms, this can include things like cracked, blistered, or bleeding nipples. Plugged ducts are a big one. Discomfort or pain while nursing. Sleep deprivation, which I'm going to put a little asterisk on this one. So when I talk about sleep deprivation, what I mean is that when baby's not able to nurse efficiently, they might compensate by nursing more frequently, and that includes at night, or maybe they don't nap because they're nursing frequently throughout the day. So that's what I mean when I say sleep deprivation. Also things like thrush or mastitis and compromised milk supply are all symptoms of possible ties in a baby if mom is having those different symptoms. As far as symptoms in the baby itself, things could include reflux, colic, difficulty latching or staying latched, gumming or chewing at the nipples, some gassiness, poor weight gain, making clicking noises when they're nursing, choking on milk or popping off the breast to gasp for air, and then milk leaking from the corner of their mouth when feeding. And so again, your baby could have maybe just one of these symptoms or multiple ones of those. So if any of those are the case, it would warrant an assessment from a lactation consultant and could potentially be due to a tongue tie. And so when it comes to ties, one big concept I want to mention is about staying in our lane. And so it's important for you to know that as a pediatric certified chiropractor, I'm not the one that's diagnosing these tongue and lip ties. So I do get a lot of moms that bring their babies in because of some difficulties, and whenever I assess a newborn, I will do an examination, and I can look in the mouth and see if there appears to be any ties. But if that's the case, then we would refer you to get a full oral motor assessment, because the function of those structures is really what's important to figure out the next steps for any possible treatment. And so oftentimes we also do get referrals from other providers and experts that know that a child has a tongue tie because they know that tension is causing problems with your little one. So we stay in our lane and focus on the tension and stress that is being put on your child's nervous system because of the ties. And I often talk about it's called like a triangle of co-management when it comes to ties. So typically the first line of defense, so to say, is a lactation consultant. So when there's any kind of nursing difficulties, that's usually the first person to reach out to. And myself and many others in the area agree that the kind of go-to person when it comes to oral motor function, as far as lactation consultants go, is Patty Smith, and she is with Nurturing Touch Therapy. She is actually so she's an internationally board certified lactation consultant, so IBCLC. She's also a craniosacral therapist and an occupational therapist. So she does a very thorough assessment and really checks to see everything when it comes to how that mouth is functioning. Another part of that triangle of co-management would be a professional that does the revision. And so the only person in the Madison area that has been trained to properly release and fully release ties is Dr. Toe, and she's a dentist with Door Creek Dental. Now, I mean, we do have a lot of awesome clinics in the area with the UW system here and American Family Children's Hospital, but unfortunately there are no ENTs actually in the whole state of Wisconsin that have received this extra training to really fully and properly revise these ties. So just something to note there. And then the final leg of the triangle of co-management would be a body worker. So what that means is someone who's working on the body to improve the tension, which would be me as a pediatric chiropractor. And so what's really important too is, yes, we work on the body, but most importantly, we work on that nervous system. And so that releases that tension in there. And so another thing I want to stress is that unfortunately, there aren't a lot of providers in the area that have additional training when it comes to recognizing, assessing, and making recommendations when it comes to ties. So I'm going to go through a few common misconceptions when that's involved. So first off, a lot of providers will deny that ties are even present, and typically they don't assess for ties in the proper manner. So I will show you with my little patient here just briefly. But a lot of times what they'll do is they'll just take the baby and just look right in their mouth when they're laying on the table this way. But what you really want is the best position to assess for ties is if mom and the provider are sitting knee to knee, and actually baby is laying like this with the head by mom's knees. So that way the provider can really look, flip up the lip, look up underneath the lip, and also lift up the tongue, usually with both fingers, lift up the tongue to see if there are any ties under the tongue. So that's the proper way to assess for ties. And really most ties are missed because they are called posterior tongue ties. And those are located on the back portion of the tongue. So posterior means towards the back, anterior is towards the front. And so anterior ties can be fairly easily recognized just by looking at it. But posterior ties sometimes aren't even visible, but they're more just felt than anything. So that's why a lot of them are missed as well with providers that don't have the full training to assess these completely. And so another thing that happens is that some providers will take a quick look in the mouth and they might say, no, yeah, your child has a slight tie. And the fact of the matter is that either there's a tie or not, but really it's about the function of the tongue and those supporting tissues. That's actually what's important. Something that kind of goes along with that too is that they'll say, oh, well, your baby can stick their tongue out, so ties aren't an issue. But what really happens is that elevation of the tongue is what's really important to get that proper seal when latching. And that's without that proper elevation, that can cause issues and tension. And so while it's true that some babies with ties can't stick their tongue out it's all about that elevation, which is the most important factor. Another thing that some providers might mention is that, ties aren't really a big deal because they'll stretch out with time, and then it won't be a problem. But really, the tissue of a tongue tie is just like the web of your fingers. And so this type of tissue, it doesn't stretch out. It is true that, if your child has a lip tie, maybe they have some kind of trauma where they, as a toddler, they fall and smack their lip on the pavement or something. That could potentially, break that tie. But typically that's not the way that people want it to go, because it can still cause a lot of problems before it's, revised, so to say. And again, that doesn't address the tongue at all, which is usually the bigger factor. One other thing that you might be told is that, your baby is gaining weight well, so ties aren't a problem. But the truth of the matter is that oftentimes breastfeeding might seem to be going well at first, and baby can typically compensate for the poor range of motion of the tongue for a period of time, which could be like the first few months of breastfeeding. And that's because mom's milk ejection reflex is still strong at that point. But over time, if that baby isn't fully emptying the breast, then oftentimes by like 3 to 4 months, which is when typically if mom works, like she goes back to work too, typically mom's supply can decrease at that point because that milk ejection reflex isn't as strong anymore. And really what triggers the breast to make more breast milk is that emptying of the breast. And so if baby isn't fully emptying it, it's not telling mom's body to produce more, and therefore mom's supply can start to dwindle, and then that can result in baby not gaining weight well. So like I said, initially they might gain weight okay, but then eventually that could start to go downhill. So now I'm going to kind of shift gears and show you what happens with a tongue tie with a lovely little drawing. If you've seen me in my other webinars, sometimes I do little drawings, and I am not an artist, so I apologize. But I have one kind of made up already here. And so what we have here is really the point, I guess I should back up and say the point of me having these drawings is that I really want parents to understand what's going on, and I want them to know where things come from, so that, when you go into any appointments, whether it's with a lactation consultant, a pediatrician, a person who revises the ties, that you feel confident walking in there and asking questions so that you can make the best decisions for you and your family. And it's important to have these people on your team that can explain these challenges, what can be done about it and what to expect. So back to the drawing here. What we have is we have the brain right up here, and then we have the spinal cord, this line coming down there. And so the blue lines on here are what are called the dural connection points. And so the brain and spinal cord, they're connected and protected by an outer layer, and that's what this is here. So that is called the dura. And so this dura, it's very similar to like Under Armour type of layering. So that's what I compare it to. It's close and tight to the brain and spinal cord, but there's actually fluid circulating in that, which is called the cerebrospinal fluid. And that protects and cushions the brain and spinal cord, but it also makes sure that the nutrients are brought to all the proper areas. But what we find is that the connection points between the spinal cord and the dura are up top here, which is called the dentate ligaments, and then down here by the sacrum, or the base of the spine. So those are the areas where this dural tension tends to build up, because that's where they connect to the body there. And so the tongue also relates to the dura because it's known as the rudder of the body. So I've heard lactation consultants describe it this way when they talk about how the tongue works and how it controls the tone of the system. And so when we're talking about tone, that's a big word for us as chiropractors, because we talk about the tone of the nervous system. So when we see tension on your little one in these two areas here, so not only can we feel and assess for that tension there, but we can actually measure and quantify that with nervous system function scans. But we're able to release that tension with specific gentle chiropractic adjustments. And so now when we have a little one who's tongue-tied, which I don't know if you can see, but that's pink in color as opposed to red, but the tongue is right there. We have the different ties there. That also creates that dural tension. And that tension is amplified in those who have a tongue tie compared to someone who wouldn't have a tongue tie. So tension in the tongue, that's where the lactation consultant and the tongue tie revisionist are going to assess and focus on. So that's right up here, while the other areas, these two down here, those are the ones where a pediatric chiropractor will focus on. And we typically see that with our nervous system scans in kids that have a tongue tie or have just gotten a revision, so they have a lot of tension in that very top portion and the very bottom portion of the spine, which makes sense, because if the tongue is locked in, the other two areas are going to be compensating as well. And if we don't take care of that top and bottom area, and we have a tongue tie revision, it's not going to heal like it's supposed to, because it's not going to have that proper mobility. And so we'll kind of go back here. I'll give you a little example here too, with a kind of like a rubber band. So if you think of tension in the system like a rubber band, with 3 different locks on it. So one's way up top here, so that would be like the tongue, that tongue tie would be up there. And then a little bit lower where you'd have that first dural connection point in the upper neck. And then the last one would be down here, which would be that kind of lower portion of the of that spine, so in that sacrum area. And so if we release that way top lock, it's still not going to let that rubber band relax all the way, because it still has those 2 other points that have tension in it. And so that rubber band is just like the dural tension of the nervous system of an infant. And then typically what happens is we actually see colic, reflux, and constipation as being a byproduct of that dural tension, especially if that tension has been there for a period of time. So for example, colic usually tends to set in for about 2 weeks. So if that dural tension has been there for about 2 weeks, or maybe even into 2 months, that's more when reflux tends to set in. But what we see is that if the top area gets locked and the bottom area gets locked in with tension, you can also think of it as another example as like wringing out a wet towel and then letting it dry. So if you, twist and wring out a wet towel and let it air dry, you have a dry towel, but it has wrinkles in the middle of it. So even if you release the top and the bottom, we're still going to see that the wrinkles in the middle. And that's where reflux comes into play. And so the longer those wrinkles have been there, and usually what we see is that it's more likely than that we're going to see reflux. So it's similar to like if you as an adult, if you wore a corset around your chest and tried chugging a gallon of water. So it's going to be really hard for us to keep all that down, and it's just going to want to come right back up. And so there can be some other components to reflux, but we don't really have time for that today. But a nerve called the vagus nerve is going to play into that too. So the next thing we'll kind of go over is, where does this dural tension come from? And so we're going to talk a little bit about what we call midline development. So there's an entire midline of the body, and that includes our brain and spinal cord, which develops first in an embryo, so very early on in pregnancy. And that's oftentimes developing before mom even knows she's pregnant. So what develops from there is all of the midline structures and then everything else outward. And so what we find is that if we have tension in the nervous system, we can have all these other challenges too that we see. So it's really important that our prenatal vitamins are high quality, and that these pregnant moms are taking a folate supplement early on, even if they're trying to conceive or if there's a possibility that they might conceive, so that then that mom has the proper nutrients for the proper development of baby. So another conversation that also comes up in conjunction with these tongue and lip ties is MTHFR gene mutations, which basically is where there's an inability to properly methylate your B vitamins, which folate is a B vitamin. So knowing the difference between the synthetic folic acid supplement and the better forms, which are folate or a methylated folate, is going to be really important for that. Another thing too is making sure our infants are less stressed during pregnancy and making sure our moms are less stressed. So that's a big factor that plays into it. And then also with labor and delivery. So what can often escalate this dural tension are intense labor and deliveries that are either like really quick, they could be really long births, or even different interventions that are used. So really smoother labor and deliveries are important, which is why we also love taking care of moms during pregnancy here at the office. But another thing that can increase the dural tension are things like nursing issues, latch issues, which lead to stress. And so when we see nursing issues start to happen, we frequently see stress that leads to panic starting to set in, and then oftentimes self-blame. So as women, we're always the first to blame ourselves, and moms, we're typically 10 times worse when it comes to self-blame. So you wonder, what did you do wrong? Or, you know, if you had just known XYZ, things would be different. But please, I'm begging you, don't look at it this way. So you're strong, and especially strong together, which is where you want to build this tribe who can help you through this journey, because it really does take a village. And when you know better, you do better. So when that stress and fear may start to set in, see a lactation consultant. That way they can troubleshoot, and sometimes that can make a world of difference, even just a small little tweak in latch or you know, switching up nursing positions. So it's important to have that tribe and different providers to help breastfeeding succeed, and to help babies who are going through tongue ties to heal properly and be as healthy as possible, so that we're not worried about, you know, weight gain or developmental delays or failure to thrive or other scary topics that can surround this. But as we continue on, I'm going to go through a little bit more on how chiropractic helps, no matter what stage of the tongue tie journey you're on. So first off, like I had mentioned before, we have nervous system scans to see the stress and tension on your little one's body. And again, oftentimes we're seeing that way up top in the neck and then way down low. But these nervous system scans are perfectly safe to do on any age. And so these scans will assess how much tension is on there, and then the different locations where that is as well. Another thing we can talk a little bit about here is if we do see that tension, typically it correlates to, if I could point right here, so again, way up top here, and then way down low here at the sacrum. And so those areas of tension, when those nerves are under tension and under stress, the body will respond, and typically a symptom will tend to come up. And some of those symptoms, again, so things like colic, difficulty sleeping, even torticollis or plagiocephaly, which is that flattening of the head. Ear infections can be problematic because that stress is built up in that upper spine there. And then, you know, stress in baby. When we look more, I guess to also the reflux I had mentioned, but when we look more down here, that tends to control different digestive processes. So having baby poop regularly, and then things like constipation, gas, gassiness, that can all be contributed to stress in that nervous system. And so we're able to do very specific and gentle adjustments, so chiropractic adjustments, to help relieve that tension, to make sure that that nervous system is relaxed and working as best as it can. And that way the body can heal and do well after a tongue tie is released. And so another thing too is with those scans that we do, we track things as we proceed through care to make sure we are getting that stress out of the system. And so that's a very objective way to make sure we're doing as much as we can to help these little ones. And so I'm also going to talk a little bit about my story when it comes to tongue ties. And so my son is 3 years old now, and when I first had him, I was a first-time mom. I knew I wanted to breastfeed, and I did know a fair amount about breastfeeding just with my studies, but you know, again, first-time mom. When I first had him, I did notice pain with nursing, and I thought, you know, that would go away. That's what everyone told me. And so I just kind of sucked it up for a few weeks, but then it got to a point where that pain was not normal. And so I sought out a lactation consultant, and actually I saw several different lactation consultants, and I was working through a few things, you know, troubleshooting. We worked on different latch, we worked on different positions, you know, all sorts of different things there. And I believe I was looking through, I think it was the La Leche League Facebook page about different things that could cause pain while nursing, and I came across oral ties. And, you know, I'm like, okay, well, that could maybe be it, but, you know, I was told that, you know, there were no ties because they had, you know, done a brief check, which I found out later on was not a full assessment. And so, you know, I looked in my son's mouth. It looked like he had a lip tie, potentially. And then I tried to look under his tongue, which was, you know, a little difficult. But I looked under his tongue, and it looked like he also had a tongue tie. And so next time I saw this lactation consultant, I brought it up to her, and she, you know, looked at my son, again, not the proper way to assess things, but she just like briefly looked at his mouth and said, you know, no, that's not a problem, not an issue. And so I was kind of frustrated at that point. In the meantime, he started spitting up a lot. So he was what you call a happy spitter. where, you know, he just ate fine, then he would spit up a lot, but then go right on with his day. Didn't really cry a lot. I did realize that sleep was a little bit off at first, and I was adjusting him, doing chiropractic adjustments on him since he was 2 hours old. So I knew that tension in general was decreased compared to what it could have been. But I knew there was still kind of something missing, especially with that reflux starting to happen. And so one more time I went back to this lactation consultant and told her about that. And her suggestion was, okay, well, let's, you know, see if a reflux medication would help. And I was not okay with that. So I'm not about just covering up a symptom. I want to know why it's there and why or how we can get rid of it and get to the root cause of the problem. And so what I did is I stopped seeing her and actually looked into more highly trained lactation consultants and came across Patty Smith, who I had known previously in passing and in different circles, but I didn't really put 2 and 2 together. So I saw Patty Smith, and she did a full oral motor assessment, which I then realized nobody else had done before. And so I got a full oral motor assessment of my son, and she said, you know, yes, there are ties in there. And she gave me a few different exercises to help kind of build up the strength to see if that would help. But ultimately, I did decide to do a revision of both a posterior tongue tie and a lip tie. And let me tell you, it was a world of difference. So within the first couple days, my pain disappeared. And then as far as the reflux, that was just, I don't know, less than a week after the revision, the reflux stopped too. And so what I learned too is that oftentimes with reflux, if that tongue isn't elevating properly, you're not getting that full seal onto that breast. And so that way the baby can gulp in extra air. And that way that reflux can happen because of extra air in there. So that can be one of the causes of that reflux if there's a tongue tie there. And so, you know, I really understand the frustration that can happen when it comes to these different ties and different tension in your little one. And just know that, again, just because some of these different things can be common in newborns and babies doesn't mean that it's normal. And so what sets me apart too from other chiropractors in the area is, number one, those nervous system scans I talked about. And so that way we can really assess the tension going on and really see how we can help. So that's important to kind of track as we go. And I also have a pediatric chiropractic certification through the International Chiropractic Pediatric Association. So there are very few that have this certification. Basically, it's an intensive certification that involves learning a lot about kind of the finesse of adjusting infants and newborns, little ones, different techniques and different ways we can help out. And really, you know, I don't take it lightly that you're literally passing over your baby and everything that means anything to you in the world. And truly, I'm honored to help care for your little one. And what I like to do is I like to gain your trust through information and education. And so with that too, there's actually an additional oral tie training specifically for pediatric chiropractors that I completed because I knew after my experience that I didn't want any other moms to have to go through that. And so again, I know from firsthand experience what you guys are going through. So if you have any questions about anything I went over, I would be happy to answer them. So you can feel free to reach out. info@familyfirstverona.com is my email. You can give our office a call too, 608-497-1801. But really, you know, if you want your little one to get assessed, I'd be honored to do so. But basically that's all I have for today. So thank you so much for joining me. And again, I apologize if you didn't get that link right away. I'll be sure to send out that replay link here too so you can get that. So thank you a lot, and you guys have a great rest of your day.